50th time today. And we've met at a time when so many Australians are now subject to lockdowns because of the Delta variant of this strain, which is causing a third wave all around the world. And we met together today to further strengthen and do everything we can to support Australians as they're going through this very difficult time. Strengthening our supports, whether they be economic, continuing to support the efficacy of the lockdowns so they can be effective, and the sooner they're more effective and the sooner they are effective, the sooner they end. And of course to continue to roll out the vaccination program, which today in the most recent data has hit another very significant mark with over 240,000 vaccines delivered in one day. Now that per capita matches and in fact betters the peak of the 7-day average per capita of the UK's vaccination program. So I remarked earlier this week, the national vaccination program here in Australia has certainly turned the corner. Challenges that we have had, we have been overcoming them now for months, and the rates of vaccination that we are now achieving are matching those that were achieved in many countries around the world, and that's what's needed to get this job done. And so today we reflected on those issues. Today we fully agreed the national plan that I outlined to you last Friday. I said it was agreed in principle last week, and that today it was confirmed and fully agreed. The national plan, that pathway that takes us to the position where we live with this virus. And we live with the virus where we ultimately start saying goodbye to lockdowns once we reach 70% vaccination of the population, and then ultimately move away from them in the third phase, phase C. Of course, all public health measures are necessary when you're dealing with a global pandemic. But these important changes, affirmed again today by all the premiers and all the chief ministers, fully agreeing to the national plan that I announced last Friday at the Lodge after our meeting last week. Today we also agreed for further work to be done by the Doherty Institute. We were joined by Professor McVernon from the Doherty Institute with further follow-up work that will be done to support both the states and territories and the Commonwealth as we prepare to move into phase B and phase C of that national plan, further understanding the calibration of public health measures and the impact on how that follows through with the virus and how it may behave. Similarly, looking particularly at further studies into the more vulnerable populations, whether they be Indigenous populations or other vulnerable populations around the country, what the potential impact is, and understanding scenarios that could occur when we eventually start opening up borders and we have additional people coming into the country, and understanding what the scenarios might be in those circumstances. They're not predictive, they're about understanding particular scenarios and how that might play out, and so we can have preconsidered our responses to those issues.